Welcome everyone to another Stork Foundation video. This is your host, Tony Mazzaferro, and I'm very excited and I feel lucky to have as a guest today Dr. Katherine Biggs to join me. She is not only one of my co-residents at our OBGYN residency training program, but she's a friend, and she is, to list her long list of accomplishments, she is a pharmacist. She is an OBGYN resident, third year, almost fourth year, getting close to being done. And the particular reason why I wanted to have her on the Stork Foundation video today is that she is applying to REI Fellowship, which is Reproductive Endocrinology and Infertility Fellowship. So she's going to be dealing with patients with infertility and going through IVF and IUI and all that stuff. So I'm really excited to talk to her about why she wanted to pursue this specific specialty within women's healthcare. And I'm just really excited to have her. So Dr. Biggs, thank you so much for being willing to chat with me today.
Oh, thank you, Tony, or Dr. Mazzaferro. It's nice to meet all of you. Hello.
Tony's fine. Well, like I said, I'm excited to have you, and you're applying to a very specific part of women's healthcare, which is infertility and reproductive endocrinology. And I just wanted to ask you, what initially led you into women's health, and then what draws you specifically to, infertility treatments?
And that is the money question. That is the question. So the reason is twofold. The first is for the fulfillment that I get from that specialty specifically, and because it's basically the coolest thing ever.
It is. It really is.
To expound
You get to
on
make
that,
babies.
yes, I mean, it's just there's so many reasons why it's the coolest thing ever, and it's interesting. So most want to help people, right? We want to heal people. We want to and so I mean, with any specialty, you can't really go wrong. There's a lot of great medicine specialties out there, but for me in particular, fertility is the most fulfilling and the understand very intimately the struggles and the through when they're trying to get pregnant. I've had a number of family members and very close friends who've had this struggle, and some of whom have been able to get pregnant and others who haven't. And so I know and understand very well what that struggle is like. And I also understand, words can't explain what that struggle feels like, nor can words explain the happiness and joy that comes from having a child after that struggle. And so to me, that is just the most fulfilling of all of the specialties in medicine that I've come across and that I've dealt with and experienced. None of them have been even able to parallel that fulfillment personally for me.
And was it your experience as a rotation, like as a medical student or a resident, or what, or did you always know that this was, the specialty for you? How did you come to this decision?
So I started investigating it as a fourth year medical student, actually, when I was trying to decide what residency I wanted to do.
Yeah.
There were a few different things that I was considering, and a family member suggested, hey, a number of us have struggled with this. You should really check it out. You'd be really good. And so I did a rotation in it and I loved it. Absolutely loved it. And I loved OBGYN. So I decided to do residency in OBGYN. And then just through continued rotations as a resident, it's really just been confirmed to me that, yes, this is what I want to do for the rest of my life. This is something that I really can dedicate my entire life to. Not just a career. It's not just a job for me. For me, it is a purpose and a fulfillment. Kind of like a life calling, I guess you could say.
Yeah. And I understand. Me and my wife have, been open with you about, our process with IVF and infertility issues. And And before we started this video, you saw our son and how, special
Yeah.
that is and how much of an impact it was for us to, have physicians who knew the science and knew the procedures and help us to have our family. And just, to know that you're going to be able to do that is, I think, is such a special thing. I think you'll be wonderful at it. Have you had any particular, I know you're obviously not a, credentialed REI doctor yet, but in the rotations you had as a medical student or as a resident, have you had any particularly meaningful experiences with patients dealing with infertility?
Yeah, I have. And those were just part of that confirmation. You know, s- one particular couple stands out to me in mind who had been struggling for years and had been through several IVF processes without any successful pregnancy. And to see the joy on their faces when they saw their baby's heartbeat for the first time is just immeasurable.
Yeah.
Um, and, uh, nothing can beat that.
No, no, I think the special thing about REI is this, at least for me, and I've only had that, 2 week rotation, but just it really kind of reaffirms just like that sanctity and specialness of like new life and family growing. And to be able to do that for someone who couldn't do it without you, it's got to be like an incredibly fulfilling specialty. Do you
Yes.
like, REI obviously has that cool aspect where you get to help people grow families. What about the technical aspects of it? Like you get to do interesting procedures, you get to, study new medicines, and the field is really growing and expanding. How does that draw you to it as well, or is it mainly just
Oh,
that?
oh
Yeah,
no, it
tell me, because I know
does.
you're currently doing
So,
research in this field. I don't know if you want to touch on that at all, or tell me what your feelings are.
oh yeah, so that's the other portion. So we talked about the fulfillment, but it really is the coolest specialty ever. It really is.
I
And
agree.
that's one of the reason that makes it that way. So I'm a person who's centered around movement. I can get bored pretty easily if I'm doing the same thing all the time. And one of the things that I love about this field is that it's
Mhm.
constantly changing. And so you get to do really awesome and cool procedures. You get to do IUIs, you get to do IVF, which I mean, uh, considering you take an egg and a sperm and you put them together and you grow a baby
Yeah, in,
outside
in,
the womb,
in the
you
in
grow
the
an embryo.
grand scheme of things, this is still relatively new technology,
Yes,
right?
it is. And it's changed significantly just in the past 10 years. Even in the past 5, things are constantly evolving, constantly changing. And that's what makes me really excited is, so that's the exciting part for me is there's the fulfillment and then there's the excitement, the thing that continues to keep it interesting and it makes me want to continue is I love doing research and
Hmm.
the thought of being able to continue doing that and through my research being able to increase the chances of someone getting pregnant, right? um, and it's a very special field in that in a lot of fields, if you're in academics, you often spend most of your time just doing research and not a lot of time in patient care. Or if you're in private practice, you spend a lot of time doing patient care and little to no time doing research. But in REI, that's
Do
not really
both.
the case. Yeah, a lot of academic centers still do a lot of patient care, and a lot of private practice settings still do a lot of research. And so, I'm not entirely sure personally exactly which way I'm going to fall. I feel like it's a little early for me to quite know that
A little
personally
bit.
yet, but just the knowledge that no matter what I end up doing, that I can keep doing that research and that patient care and really continue to be on that cutting edge, continue to make that difference, find new knowledge, find new things to make things better is just so exciting. And that's what makes me excited about my research project is it's about finding what, just in brief, just if
Yeah.
there's a better time to transfer frozen embryos and IVF cycles. There's still a lot to be found out about optimal timing for transfers, and the knowledge that just with the research that I'm doing now, that I could change things for people worldwide
Mhm.
with this research is ah
I know, just the
it's
thought of
so
making
great.
that such an impact, such a change in countless lives, I think is pretty special. And you're doing, yeah,
Yes.
really important work in that field,
Yeah.
in that regard. And I guess it's another question I had for you, and I know we didn't really discuss this, before the interview, but it seems like with infertility, there still is somewhat of a stigma or reluctancy on those who are struggling with it, to talk about it more openly. What do you think about, or what do you think people can do to, try to, I guess, bridge that hesitancy or overcome that hesitancy? Because it is kind of, especially with more traditional families or more traditional circumstances, it can be kind of something that's a little bit more uncomfortable to talk about. I mean, what do you think that as a
Mhm.
society we could do to make it more transparent or more open about these things and not as much of a stigma?
Um, I I think being willing to talk about hard things and being willing to accept difficult emotions
Hmm.
is part of that, because it is such an emotional and deeply felt thing, um, that it can make it very difficult to talk about, aside from any of the social stigmas that are already around it.
Hmm.
So, those on the other side being willing to accept the difficult emotions behind it and being willing to, you know, mourn with those who are mourning, and uh, accept that, but not also necessarily feel guilty about what they have at the same time.
Hmm.
Because I know in my own family that's been a bit of an issue sometimes. Those who haven't had any issues with fertility, um, almost being embarrassed to talk about it with those who have,
Hmm.
because they feel like they might be causing more of a harm or more of a more pain to them. And so just everyone being able to open up their hearts to each other and to accept difficult things, I think would help.
Yeah, and I think, yeah, I think that's awesome, and that's great just to be kind of open with each other. And I think also people might not feel comfortable talking to those who have gone through infertility issues because they don't know what to say. But I think just
Yeah.
people acknowledging that it's okay. Like some people have these struggles, and that's just a part of life. It doesn't mean there's something, doesn't mean that there's something extraordinarily wrong with you. It's just things happen in life, and that's okay, and we'll be there for each other. But I notice kind of historically and societally, it is somewhat of a stigmatized topic, but it's,
Yeah.
especially in, certain communities, it's like, oh, you're married, you should have a kid like right away, like in a year or two. If you haven't, what's wrong? What's going
And
on?
so
Well,
what's wrong with you?
something's wrong with you. And then sometimes people might not realize or think, wait, maybe they want to have kids, but for some reason they can't, and just to be kind of sensitive to that. And it just this conversation reminds me of someone I talked to recently who has struggled with infertility, and they were successful in conceiving and having, a positive pregnancy test and seeing that heartbeat. And then shortly after, within the first trimester, the heartbeat, stopped. And they just realized, or they talked about how in their family situation, that was something that they couldn't even bring up because it was just such a challenging, they didn't even know how to. So I
Mhm.
just, appreciate you saying, just being open and being there for each other, no matter what the experience is, and supporting each other. It's to help those in a situation where they might not really know how to even process it themselves, I think is really important.
Yeah. What have you found helpful?
Oh, that's a great question. I mean, obviously, just talking with my wife, it's been, we haven't been super transparent or open with like our close family, and
Mm,
I I'm not sure exactly why that is. I think it's partly just discomfort on how to even bring it up. It's like, how do you bring that up? Just say, oh, by the way, this is a problem we have. It's kind of an uncomfortable, especially when everyone around you and siblings and stuff have kids without any issues. It's like it's just something.
yeah,
How do you even approach the topic? But what has helped me is just my faith and believing that there's a plan for us all, believing in a higher being, and believing that there's a plan for my wife and I, and our community around us. But even though we have close friends and family and a faith, it doesn't necessarily mean that it's easy to talk about with these people, if that makes sense.
it does.
Yeah. Well, I know you're a busy woman. You're a doctor. You're a pharmacist. You're on vacation, but I really appreciate you joining me for this conversation. And I know you as a friend. I know you'll be a fantastic REI doctor. You're compassionate, really intelligent. You'll do wonderful things in the field and the research, and just in your bedside manner. I think you'll just really help a lot of couples who need that and are struggling to have kids. So thank you so much for joining me. And yeah, thank you so much. Really appreciate it. I know you do great things.
Well, thank you very much, Tony, and anytime.